Hello, I'm Deirdre Murray, Professor of Paediatrics at University College Cork and the co-founder and CEO of Liltoda. Liltoda is an academic spin-out company from the Infant Research Centre at UCC, where we have developed groundbreaking touchscreen-based digital assessments of learning ability in young children. We know that 50% of children with learning difficulties are not diagnosed before they start school. This means that many children struggle for years before that crucial diagnosis. According to the American Academy of Pediatrics, there could be as many as 1 in 6 children living with developmental disabilities which impact their ability to play, learn, speak, or move. Why is this the case? The problem is that assessment of learning abilities is difficult in young children, and even more difficult in children who have not yet learned how to speak or when English is not spoken in their home. This means that in many countries across the world, reliable, standardised assessment is just not possible.
We have built touchscreen-based digital assessment software based on a decade of research and clinical validation at UCC's Infant Centre. Our Cognitot solution is an exciting disruptive innovation. Cognitot harnesses touchscreen and gaming technology to create an assessment that is not reliant on a child's language or verbal skills. The interactive nature of the tasks makes it extremely engaging for the child, while also remaining language independent, objective, and low cost.
Existing assessments are paper-based and require time-consuming report writing by a highly trained child health professional. This makes them too expensive to allow screening of all children. Only the children that are at highest risk are offered assessment. It's therefore not a huge surprise that so many children miss out on a critical early diagnosis of conditions such as learning delay. Cognitot's standout potential as a game changer for the assessment of children's developmental progress is clear. It can check a 2 to 3 year old child's developmental progress in just 20 minutes, and its automated reporting means that the assessment results are available immediately to the clinical team.
The scoring algorithm and reporting function has been used in 5 investigations carried out in 12 countries. We are in the final stages of a patent submission to both European and US patent offices. Since 2021, Cognitot has been actively used by key opinion leaders on pediatric research studies, including the SafeBoost Phase 3 clinical trial sites in 12 European countries, the National Institute of Mental Health at the NIH in Washington, D.C., the Cusick Lab at Trinity College Dublin, the Copenhagen Clinical Trial Unit in Denmark, and the BABA Centre at the University of Helsinki. We have secured a distribution partnership with Brainworks Limited, who have strong market positioning as a significant supplier of psychological testing materials to the UK and Irish professional networks of child psychologists, educational psychologists, and occupational therapists. The combined EU, UK and US preschool screening market is estimated to be worth more than €5 billion per year. Liltoda's commercial focus is on the primary care market, where there are approximately 120,000 clinics in the US and more than 100,000 clinics in the EU. The market opportunity for Cognitot in non-English speaking countries is considerable, given the product is language independent and has been validated in multi-ethnic populations. Our commercial focus is to secure 130 clinic customers by 2027, with recurring revenues exceeding €500,000 per year. The opportunity for Spark crowdfunding investors is very attractive. Investors can invest up to €400,000 in exchange for 16.67% of common equity. The €2 million pre-money valuation is underpinned by matched funding by Enterprise Ireland and projected recurring revenues of over €500,000 in year 2. The valuation multiple of 4x year 2 revenues is well within industry ranges and offers an attractive investor entry point for an innovative solution developed over 10 years of pediatric research and testing with more than 1,000 children in 12 different countries. Liltoda also qualifies for 35% EIS tax relief.
I'm Professor Deirdre Murray, Professor of Paediatrics in UCC and CEO of Liltoda. Mike Cunneen is our Chief Technical Officer, experienced health app developer and UX designer with more than 6 years in startups and paediatric clinical research. And Mairead Murray is our lead for clinical research, ethics and validation, with more than 12 years of experience in paediatric studies across academic, industry and international trials.
Cognitot is a game-changing tool for developmental assessments of children thanks to its language independence, speed, low cost and objectivity. The problem is huge. 50% of children with learning difficulties are not diagnosed before school age. The opportunity is global, and our assessments have been tested in over 1,000 children across 12 countries. The founder team has a world-class mix of pediatric medical expertise and experience of commercial development of technology and digital products. The EU, US and UK preschool screening market is worth €5 billion alone. Liltoda's pre-money valuation of €2 million and projected year 2 recurring revenues of €500,000 makes an exit of 5x for Spark investors a realistic opportunity. The company is an Enterprise Ireland client. Liltoda is an EIIS qualifying company, meaning that investors can avail of 35% tax rebates, meaning a €1,000 investment costs the investor a net amount of €650. The minimum investment is €100.